people tend to only want to be around people that agree with them. And when something controversial like a national health care policy comes up, instead of a healthy debate where you have people with varying opinions in a room with everyone listening to each other and maybe modifying their opinion, changing their opinion as a result of listening to other people, or not changing as a result of listening, being more firm in your beliefs, you don't really see that. Instead, what you see is everyone with a preconceived, predetermined opinion surrounding himself with people who agree with them and then going after everybody who doesn't agree. And these tactics are just classic and fit into that. So it's almost like a symptom of an overall problem. And I would make an observation that what happens is when any of us, you or I or any of us, if we surround ourselves with people who agree with us, we get more adamant about our position. I do think it's a strategic effort on the part of some people. I don't think it's highly centralized, but I think it is strategic. And I think the key now is to watch what, just like always, to watch what moderates and the majority of the voters and the public think as they see these tactics. And you can argue that in the 60s, a lot of these tactics backfired and didn't make people more liberal, in fact made them more conservative. So will these tactics make people now, since they're led by conservatives, maybe more moderate and more liberal as a result of this? It's possible, because in our history, there's usually a recoiling to these tactics by a majority of people. Yet to be determined, but it's very fascinating to watch what's our reaction to these disruptive tactics. Will we adopt them, or will we recoil from them and have more sympathy for the president and his policies?